In pressure injury surgeries, primary wound closure edges are approximated to close the wound either directly or in layer. Skin graft. When the skin defect as the wound large primary closure is not visible, surgeons ought to take a graft of skin from healthy area and cover a denuded area of the wound. Facilitates acceleration of wound healing through quick wound cover. Local random pattern flap. Local tissue around the wound mobilized into the wound defect, maintaining the pattern of blood supply of the tissue. Regional flap. In this technique, muscle or musculocutaneous flap or fasciculocutaneous flap used to cover the wound based on defined blood supply. Once advanced and refined technique, namely perforator flap method, where the flap are used with specific perforating blood vessels identified in the flap and dissected to allow either greater movement or less muscle sacrifice, as well as separation of components to each flap. Free flap. In this approach, a defined island of tissue with artery and vein is surgically detached and moved to other cover the wound. Local blood vessels of similar caliber are identified and anastomosed to the donor vessels to restore the vascular supply. Tissue expansion strategy of gradual increment and recruitment of tissue surrounding a pressure ulcer. One tissue expander is placed into subcutaneous pocket near the margin of pressure ulcer and gradually expanded with normal saline at defined rate. After the desired size of skin and subcutaneous tissue is achieved, the expander is removed and expanded skin is moved to cover the wound. Split thickness skin grafting (STG). The split thickness skin grafting not an option of choice. Graft often fails to withstand any pressure if post-operative proper and adequate care is not taken regarding positioning as posture. Sacral ulcer perforator flap technique undertaken, whereas retrocontric ones musculotendinous graft with tensor fascial arteries commonly done. Decision for surgery becomes difficult because of poor constitutional status of bedridden individual. Aftercare is basically targeted at protection of grafted tissue, prevention of infection and trauma, offloading mandatory for 2 to 3 weeks. Negative pressure wound therapy (NPWT) and also known as VAC, vacuum assisted closure therapeutic technique using vacuum dressing to promote healing in acute or chronic wound. Occlusive bandage, special dressing. Occlusive bandage is sealed over the wound and gentle vacuum pump is attached. Ultrasound therapy (UST) for healing. Electrical stimulation in UST common for reducing musculoskeletal pain, increasing microcirculation, enhancing mobility of soft tissue, helpful for reduction of inflammation and healing to degranulate the mast cells and promote wound contracture by